Welcome to Caring for People with Dementia, a primary care partnership. This is Lesson 4, Communicating. Good communication is associated with various positive outcomes, including treatment adherence, well-being, adaptation, and patient empowerment. However, there are challenges in communication between patients with dementia and their primary care providers. Patients and care partners report unsatisfactory interactions, particularly related to how and what guidance is communicated. Providers report frustration, discomfort, complexity in navigating the patient-caregiver relationship, as well as a lack of knowledge about how to communicate effectively. Communication challenges of people with dementia might make it difficult for them to both understand and articulate with words, so providers have to adapt their communication style. In the spirit of patient and person-centered care, here are some perspectives on communication from people living with dementia and their care partners.
Be honest and be realistic. I think the one thing that really helps, like I said, is when they move up closer to you. They're not standing on the other side of the room, and they're being honest, and you can see it in their eyes that they're not distracted and they are there for you.
So everything that he had to do to her, he walked her through it, looked at her and explained and asked her, do you have any questions? And then he would look at me and say, do you have any questions? But he addressed my mother as if she was the only one in the room. And he made sure that she understood what was happening each step of the way. And even the nurses that came in, they walked her through it, even to take the blood pressure, to take her temperatures, whatever they were doing. You know, they looked at her, they didn't talk to me, they talked directly to her. And that I appreciated.
I think if the doctor's making eye contact, talking to us, I attend the doctor visits with my wife, and we're sitting side by side and share the attention 50-50 between the two of us. She's still a person. You don't treat her like she's gone.
But from that first visit, it was very positive for her because they had an interpreter. She's a Spanish speaking, and it was so hard for me to take her to doctors and me being the translator, because no matter what I said, it didn't matter. So when they use a translator, um, she felt confidence with them, and it was different when her approach was different. I guess she was able to talk freely. Um, for her, it's like I was making everything up. There was no way she could understand. She understood in a way, but she didn't want to accept. So from that day, so having the interpreter, it really helped her. She felt like her voice was heard.
In addition to clinical skills, primary care providers benefit from enhanced communication skills for optimal dementia care. These skills take into consideration the communication challenges of people with dementia while honoring the importance of involving them. This includes considering how to engage a person with dementia in your interaction with them, regardless of where they are in their progression of the symptoms. How people with dementia are involved in the conversation might change with where they are in their progression of dementia and the emotional impact of the conversation. Here are some communication techniques to keep in mind. Face the person with dementia. This helps them better focus on what you are saying. Sit with them whenever possible. This says, I have time for you, and makes them feel more comfortable. Slow down. It's disconcerting for people with dementia to have things happen quickly, people rushing around them, etc. Be present. Make eye contact and try not to look at the computer or phone.
Hi, Mr. Carter. Nice to see you. Looks like you brought someone with you today.
Yes, she's my daughter.
Hi, Andrea. Nice to see you. So how are you doing, Mr. Carter?
Just fine. I have a little trouble getting around, but I'm just fine.
A little trouble getting around, I see. So tell me what's going on.
Well, you You know, honey, you know what I mean.
Dad, I know you feel a little woozy sometimes. Is that right?
Yeah, woozy.
So, Andrea, how do you think your dad is doing?
Well, Dad's doing well, but there does seem like there's times where he gets confused and he's really out of it.
I do get confused.
Dad, I'm wondering if Dr. Nelson could help you with your confusion.
Mr. Carter, there could be a number of reasons for your confusion. Let's check you out and see what might be going on.
Be in their reality. Go with the flow. Accept the response of the person with dementia as their perspective. If you're concerned about the accuracy of the response, sensitively ask for the perspective of the care partner. Develop connections with people with dementia through verbal and nonverbal ways. Smile, nod, show attention, and call them by their preferred name. Tell the person what you are doing or going to do one step at a time.
Well, I'm glad you're both here. So, how are you feeling, Mr. Carter?
I'm feeling fine. How about you? I just can't believe it's you, Sam. We had such fun times in college. You know, honey, this is Sam.
Dad, that's not...
You know, college was crazy. Can you believe I became a doctor?
You'd never believe it.
So, Bill, since I am a doctor, how about I check you out?
Yeah, fine with me.
Ask one question at a time. If open-ended questions are not working, like how are you feeling, try yes/no questions like are you in pain? Give directions one step at a time. Follow up with written summaries or information. The visit will likely be overwhelming and the person with dementia may not remember details of the visit. Good communication techniques with family members is also key. Family members can provide important information about people with dementia that can help you care for them. Also, as care partners, they might be experiencing their own challenges, and your support and guidance are important to their ability to support a person with dementia.
Well, I am glad we had these few moments. Before we meet up with your dad, is there anything that you want to share with me that we may want to address together?
Actually, I doubt he will bring this up, but we have been having challenges getting him to take his medications.
Okay, so what are you seeing happening?
These communication techniques not only support the needs of people with dementia and their care partners, they hopefully support you as a provider to ease difficult conversations and interactions. Given the lack of effective medical treatments for various causes of dementia, the role of communication within the provider-patient relationship becomes even more important in supporting both the person with dementia and their care partner to manage their overall well-being. As you look for opportunities to apply what you've learned, consider trying one of these microsteps. Practice sitting with and facing patients with dementia so that you can be eye level with them whenever possible. Consider how you might ask questions in different ways so that people with dementia can better understand them and respond. Practice active listening, even when the patient with dementia might be saying things that are not accurate. Or come up with your own microstep. Each microstep moves you forward to a primary care partnership with your patients with dementia.